Neil, thank you so much for joining us Monday morning. I want to talk first and foremost, you were very vocal about what was going on with the government in regards to the situation involving really a non-payment until June or July in regards to operation of clinics. The government on Friday made a change. Is it the change you wanted?
So the government on Friday announced to the media that they would provide what they've termed income stabilization in the form of a loan that would be paid back at some point in November thereafter. I'm not aware of the actual official offer to the Ontario Medical Association. They leaked this to the media. The devil, as you know, Greg, is always in the details. And so the problem with a loan, though, is many clinics' patient volumes are down significantly. So what the loan essentially does is it puts the cost of the pandemic management on the backs of doctors. And remember, the payments to doctors go to pay their clinics, their overheads, their staff, their equipment. So we will have to pay that back at some point in time. And it's not entirely clear that the volume of patient care will actually be able to do that. So you can't ask a doctor to, see 40 more patients in a day just to make up the payment of the loan. That's just physically not possible, and care will compromise. So if my understanding of that offer is correct, then I don't think that's acceptable. What's needed is a grant.
There's going to
Mm-hmm.
be incredible burnout for doctors and frontline people. There's going to be the issue of the getting paid scenario, which you still are not totally satisfied with, to be blunt. What about those scenarios? Do you have to go back to the government and ask for even more help because you need it?
I think to address that question, I think I need to look at the offer. The OMA needs to examine the offer carefully. I think part of dealing with burnout, I mean, there's many aspects to this. From the financial side, yes, it might require going back to the government. Um, but the reality is, Greg, many doctors across the province are putting it all on the line. And we're human too. We have families too. So when I go to hospital, for example, and I treat my patients, I bring that stress home with me, and I bring the likelihood of transmission to my family. So in our household, we've adopted strategies to try and separate myself from my family, but that comes along with stress as well, and a lot of anxiety. So, you know, the healthcare aspects, not just for patients, but healthcare providers, my nursing colleagues deal with this too. It's staggering. And so for now, we're all in this together. We're leaning on one another as best we can, knowing that sometimes one of us will need help more than the other. But yeah, that this is also going to be a long-term strategy for healthcare providers required.
Providers should get an increase in pay because of the risks that they take.
So hazard pay, as some have called it. I mean,
Yes.
I think this is my own opinion. I think that is a fair ask. Many doctors, over hundreds of doctors, have died across the world because of this, because they've been fighting with inadequate PPE, which could have been mitigated against had we followed our SARS pandemic planning. So I think that's a very reasonable ask. Um, Again, I suspect the government has a very different perspective on this, but along with my other physician colleagues, are risking their lives, and we're seeing and intubating patients with COVID. So I don't think that's unreasonable to ask, and I think that's important.
Thank you so much for your time.
My pleasure, Greg. Thanks for the opportunity, and I look forward to speaking to you in 2 weeks. And be safe.
Thank you, sir. Same to you.